Oh. All right, welcome everybody to another Zoom call. We're to June. So hopefully, I was going to put some pictures of our garden up so you can see that. And of course, I forgot. So maybe next time, encourage you guys to get out and get some fresh air gardening. Just because it's our hobby doesn't mean it has to be yours. So remember, when you do your cheek swabs or you request a coaching call, please fill out the cheek swab request form. Here's a picture of the coaching call request form. You can pay for it online as well. And then we have another box on the member site for the cheek swab request form. So please fill that out online. It's better, it's easier for me if you do that online. I know some people would rather print it and send it. I guess that's okay too. Remember to always look at the member site for any new information. And like the new information a couple weeks ago, now we have a subscription service. If you want to subscribe and save for your supplements, you receive a 5% discount on your total order, each order. Remember, again, all the courses are available to you. And remember to look at the blogs to get questions answered if you're in between weeks. Sometimes I had written a blog about it at some point in time. Okay, let's jump into the questions. I had an incident happen with my Rife machine, and I'm concerned it's been damaged in some way. Unbeknownst to me, a toddler had been in the room where I was staying in a cabin and unplugged the red bulb cord. So the red cord for the bulb. I started it up that night and it was really loud. Yes, because the electricity is coming out of that that outlet piece in the red cord, and it will arc to the other one. I realized the red cord had been unplugged. I absolutely panicked, actually switched it to bath for a split second, got a little electric shock. Then from touching the empty red plug-in, yes, I've actually turned on my Rife when I was actually programming somebody's Rife once and never had a bulb plugged in, and I got shocked. I mean, you're not going to get electrocuted. It's not that high a voltage coming out of that, but you will get shocked and it will scare you. I then just unplugged the power strip from the wall, turned it on, and it seemed to work fine, but I'm second guessing it. So at most, in doing something like this, you will, worst case scenario, you'll burn out the transistor on the back, but really you'll blow a fuse before you do that. So you didn't hurt your Rife, so don't worry. I don't remember the red on button blinking when there was no program running, and I feel like the bulb seems dimmer. I ran the 20-second bulb check and it lit up like it said it should. Now, how do I know if there's internal damage there? If it's working, you don't have internal damage. You didn't hurt the Rife. Don't worry about it. If it hurt the Rife, it wouldn't work. And then the first thing you would do is go back to the Rife section on the member site, or go to the Rife course and go to the troubleshooting guide. And the first thing it'll tell you to do is to, check your outlets, check everything like that, and then check the fuse. So worst really case scenario on something like this, you would have blown the fuse. That's what a fuse is for. So, but you didn't blow the fuse and it works just fine. I sent you some pictures and some lab reports. The pictures seem to show a bit more pink around the nipple. What are your thoughts on that? Um, so if you have any pinkness or redness of the skin, or if you have good heat sensation on the back of your hand, you could actually feel for temperature changes. Or if you have one of those little um, thermometer checkers that were popular during COVID and before that, where you could check a person's, forehead for their internal temperature. Those are actually really good little units to check temperature on your skin. So you could check the temperature, 6 inches away from the tumor. on the breast and then check the temperature right at the tumor. And if it's an increase in heat, is that a bad thing? Well, no, that's showing that there's inflammation at the site. Now, if you didn't have cancer and you're not trying to kill cancer cells, then you would say, yeah, that there's something going on. Let's say you got a bug bite. If you use that little thermometer, surface thermometer on a bug bite, it would show increase in temperature at the bug bite, most likely compared to 2 inches away from that bug bite, because you have this inflammatory reaction taking place at that bug bite, because that's what a bug bite is you have the bug that inserted toxins into your skin, into your body while it took out blood, and the bug, and now you have this inflammatory response to those toxins, and that's why you get this reddish, or you get a raised bump, or you get itchy, you get a histamine response, etc. So is that a bad thing with cancer? Well, no, it's not. What's what you're trying to produce is that. So just because, oh, my tumor is more red or it's hotter, that's not really a bad thing. You're trying to get an immune response to kill it. So I wouldn't say the color is a bad thing. Next part of the question. Last Friday, I had dark red discharge for just a little bit, but nothing since then. So a dark red discharge, was it blood? That wouldn't be necessarily uncommon. And it's not uncommon to have that change and have a little bleeding from the nipple or bleeding from a tumor, and then it goes away. So I wouldn't be too concerned about that. Do you have any suggestions with the thyroid labs I sent? I'll have to look at those again. The TSH in March was 1.81, which is fairly low. The free T4 is 0.89, which is low. And the T3 is 3.3, which is within normal limits. So so remember, what you really should be receiving with the thyroid lab, and I know this is what you got, but if you're going to ever request thyroid labs, if anybody is going to ever request thyroid labs, if you don't get it on our site, then you do want to, you got TSH, you got free T4 and T3, I assume that's free T3. You also want to get reverse T3. That tells you if your T4 is being converted to reverse T3 and issues with the gut. You want to make sure you get TPO antibodies, and you want to make sure you get thyroglobulin antibodies. And total T3 and total T4 will be the other things that would be good to get. That gives you a better picture of what's going on. If you have elevated TPO antibodies and or thyroglobulin antibodies, then we know that we have an autoimmune condition going on with the thyroid, and now we're dealing with Hashimoto's, and that's a whole other ball of wax. If you don't have elevated thyroglobulin or TPO antibodies, but you have low T4 or high or elevated TSH, then you're concerned with just primary hypothyroidism, and you want to deal with that. If your thyroid hormones are what they're at right now, and let's say your reverse T3, no, you didn't get that run, let's say that's within normal limits, and you have normal limits of TPO and thyroglobulin antibodies, so those are not elevated. Let's pretend, since we don't have those. And this was your readings, what you gave me. Then you're going to look at the patient's symptoms. So what are my symptoms? Oh, I'm just fatigued all the time. I just don't have any energy. I can't lose weight. I am losing my hair. I'm losing the outer 1/3 of my eyebrows. I just don't know what's wrong with me. Then you want to supplement, if you're not supplementing, with some thyroid stimulators. First of all, before you go to medication, you'd start with some nutritional support of the thyroid gland, some thyroid glandulars. If I don't remember your case, I'm sorry who asked the question, I don't remember if you're already on medication for your thyroid, but I would not change your medication based upon the test results. I would change the medication or tweak the nutritional approach based upon your symptoms. Your thyroid gland, you always want to treat your thyroid largely based upon your symptoms, not largely based or primarily based upon the labs. So if you want more information on the thyroid, go to, I believe it's module 6 or 7 on the autoimmune course. The entire module is dedicated to Hashimoto's and understanding thyroid labs. The oncologist said he is finding that letrozole doesn't work in cancer anymore. So he's probably talking about your cancer, not cancer in general. But yet he wants me to try it for 6 more weeks. Me trying this doesn't make sense. So, but I'm not a doctor. Starting to get some tingling in my back again, in my back again, like back in October, November. Another node started under the axillary node, the axillary node, I think she said. He said he wants to finish a cycle and do 1 more, and then he will look at a different family of chemo pills and shot. I do have an update into him, and we'll see what he says. So let me know what he says. My mutation is a PIK3CA, not as common in breast cancer. Not sure if this makes a difference. Looking into mistletoe therapy again. The tingling in your back, certainly getting another look at that might be a good idea. Now, your biggest sign of like pathological fracture, because this person has Mets to the bone, biggest concern with pathological fracture symptom-wise is going to be pain. So the tingling in the back doesn't give me such a great concern. There's so many other possibilities in a differential diagnosis picture to look at with that. I do believe when I looked at your blood work, when you sent it to me the other day, that your tumor markers were still elevated. So yeah, I would have another talk with your oncologist to see what his plans are. Last week, I asked about why, if you have cancer, doing a water fast or perhaps any kind of fast is not so good. I understand that you said fasts greater than 24 hours increase IGF-1 levels, and increased IGF-1 levels can help cancer grow. I mentioned this to Dr. Goldheimer, who is the director of True North Health, as I originally mentioned that I understood water fasting not to be good for cancer patients, and he was only curious why. His response was that IGF-1 is reduced while fasting. That is generally seen as a good thing. What is his or Dr. Connor's concern about possible temporary transient reduction in IGF-1? So I don't know that is his comment is true. I believe that one of the benefits of doing longer fasts is that you do have an increase in IGF-1, and that is the benefit for people, because increase in growth factors as we age does nothing but good things unless you have cancer. So there's numerous studies where I came to the decision of the elevated IGF-1 it happens with the fast. Now let me take a step back from that comment a little bit. There's other good things that happen with a fast. So, and I said time and time again that I don't think it's always wise to do greater than a 24-hour fast for a cancer patient, but it's not just because of IGF-1 levels increasing. It depends, but it so depends on the person. Everybody's different. If you do a greater than 24-hour fast, you're definitely going to lose weight. And if you have weight to lose, well, then if you really feel led to do a greater than 24-hour fast, a 1 day, 2 day, 3 day, week fast, we've had people do a 21-day fast. That seems pretty hard. I've never done anything like that. But if you feel led to do that, then by all means do it. Just make sure that you have weight that you can lose. You don't want to push yourself in a state of cachexia, because that is one of the most difficult things for a cancer patient to get out of is if you're in a state of tumbling weight. Then you have to resort to not only eating more, but you have to resort to really pushing carbohydrates, because that's the only way you can really get out of cachexia. So just be careful of that. I know that there's studies, and you did find this meta study where IGF-1 levels decreased with fasting. And I know there's studies that will show both things. I do think that there's other benefits of fasting. So, and doing a 3-day fast or a 5-day fast, there's other benefits to that that could maybe far outweigh any negatives that could go with a cancer patient. So I'm not against doing that. I'm just saying in general, especially if the person is kind of at their weight or below their desired weight, doing a greater than 24-hour fast may be indicated. If they have, well, I have 30 pounds and I could lose, and well, then it might be a perfect thing for you to do. If you feel led to do that, then by all means do that. So, and then I do want to make a point on studies. I am big into looking at studies, but boy, it is becoming extremely disconcerting when you're looking at studies, because there's so many contraindicative studies out there. There's one that says this and another one that says this. And it's like, what in the world are these? Why can you have all these studies that contradict things? Matter of fact, somebody sent me a study on glutathione and cancer, that in taking glutathione can actually help the survivability of a cancer cell. So therefore, you shouldn't be taking glutathione. Well, the problem with some of these studies, like that study, and numerous studies that show that taking glutathione for a cancer patient helps the survivability of a cancer cell, are studies that got approved because they were doing it with chemotherapy. So I would agree that if you're taking glutathione while you're taking chemotherapy, you're going to have a lesser chance of the chemotherapy, aka an oxidizing agent, kill a cancer cell by poisoning it with an oxidizing agent if you're taking antioxidants. So understand what glutathione is. Glutathione is your main intercellular antioxidant. And if you're taking glutathione, you're going to help with oxidizing agents that can damage your cell. And understand, oxidizing agents are the #1 cause of cancer. So when you say, my cancer was caused from a toxin, different exposures to toxins, different exposures to heavy metals, what are all those things? They're oxidizing agents. They damage cells. If they don't kill a cell, well, they could get in a cell and damage the DNA, thereby causing rapid replication. Chemotherapy is a poison. It's an oxidizing agent. If it doesn't kill a cell, it can actually get inside of a cell and cause damage to the DNA and cause cancer. I'm not saying that chemotherapy is necessarily the wrong thing to do. I'm just saying that just understand where all this is coming from. So from a natural perspective, natural doctors over decades have pushed things like antioxidants, like vitamin C therapy, like glutathione, like curcumin, like nutrition that will help support, like alpha lipoic acid and things like that will help support oxidative stress, superoxide dismutase, things like that help support the damage of cells from oxidative stress, which is from what's oxidative stress from? Poisons, toxins, pollutions, chemicals, additives, flavorings, colorings, heavy metals, toxins in our environment that cause this damage to our cells, that can get inside cells. And remember, anything like this that gets inside the cell that could damage cells, that could damage DNA, it can be the cause of cancer, and can kill cells. That's what a poison is. If you drink enough poison, you die. Why? Because you have excessive oxidative stress causing cell lysis, and it just destroys the person's liver, and the person dies from poison. So that is just how our bodies work. So taking antioxidants helps protect that. The other fact is that your body actually makes glutathione. It recycles glutathione. That's why glutathione is the number one. You don't necessarily need to take glutathione. Your glutathione is made through a cysteine pathway, and glutathione is recycled inside the cell, inside all your cells. So even if you're not taking glutathione, you're still making glutathione. Your glutathione is trying to protect your cells. So long story short, there's lots of studies that will show lots of different things, and you got to kind of take them. Good to learn things from it. And hey, I'm all into citing studies and looking at studies. I'm growing weary, though, in the last few years because of so much publication bias. Publication bias is who funded the study? Well, that's the answer that they're going to get. It's just that's the way it is. Now, the truth about fasting is there's positives and negatives to fasting. So you got to figure out whether positives outweigh your negatives when you're dealing with it. That's where, like any question you have with anything you're doing, having that relationship with Jesus Christ so you can be asking him and feeling peace about your decision is one of the best ways to know which way to go forward. I've used my new Rife 3 nights. Tonight, the Sunday program started beeping almost like a truck going backwards. Since this makes sleep impossible, I ran the Saturday night program again. Notice a high pitch but low volume noise from the Rife as well. Is this normal? What do I do about the beeping? Unfortunately, that is normal. It will beep more at different frequencies. And there's nothing that you can do about the beeping. Now you can use the amplifier jackhammer with it and keep the bulb under the bed and cover the Rife machine up. That will help. So most people will just get used to it and then they just sleep through it, and it doesn't cause a problem. We've had some people that had to go to the point of putting earplugs in, but now with the jackhammer, you shouldn't have to do that. You can cover it up and you'll still get the benefits from it. I have a magnetic pulsar by SOTA. I have had my left breast removed and have had radiation and chemotherapy in 2020. Would the magnetic pulsar be a good thing to use, and where should I use it? On the removed breast area or on the remaining breast? Well, I'm not a good person to ask about that. I have never used this piece of equipment, and I did not have time to do any research on it. I would talk to the manufacturer. I can't endorse it. I can't say, oh yeah, use it, because I just don't really know what it does. I'm sure it's using frequencies of some kind, and I'm sure it could be beneficial, but I wish I could give you more information. A gross question warning. Should a severely itchy rectum and surrounding skin could severely itchy rectum and surrounding skin be reacted to the coffee, acid, other in a coffee enema? I do them daily. I do have a latex allergy. I called Premier coffee enema product, the enema itself, asking if there's latex in the enema kits, and they said no. However, there was something else in their attachments that sounded questionable, but I can't think of what it was. Or could it be parasites? I've been taking fenbendazole for a while, or hemorrhoids. Typically, a severe itchy rectum is not good. Well, could be hemorrhoids, probably not though. And if it's surrounding skin, it's more like a reaction to something. Certainly could be a reaction to the coffee. Yeah, I would maybe just give it a break for a bit. Use some olive oil or coconut oil on your bottom and let that heal. Just, I would give it a break. I don't know what you could be reacting to. It certainly could be something in the plastic, could be the coffee. I could it be parasites? Maybe. the only way to know parasites, I mean, technically we learned how to look for parasites in severely itchy rectums. You have to put a piece of tape down on your bottom and pull it off. Ouch. And then take that and put it under a microscope and look and see if there's eggs that are coming out. But I would just honestly just give it a break for a bit. Thanks for the cheek swab results. Is Cleartox a replacement for the PON-1? No, it's not. So Cleartox has different nutrients in it to help pull out. I mean, it was really created to help pull out mRNA and the effects of the vaccine and the effects of COVID. So it's not a replacement for PON-1. PON-1 is, or phase 2, is really to support the PON-1 pathway, which is your phase 2 pathway in your liver. AromaClear, is that a replacement for the ClearDim? No. ClearDim has some things in it that the AromaClear has in it, but AromaClear has a greater concentration of a few things. That's why I think it tested for you. Do you like or support the idea of using the jackhammer attachment as it really amplifies the effects? Well, it does. So it amplifies the output. So it increases the strength of the output. It doesn't change the frequency. So it increases the strength of the output. Thereby, you could have the bulb farther away from you. So if you're already used to having the bulb right next to you or snuggling with the bulb, there's really no need to use the amplifier. Personally, I don't use the amplifier because I've been using the Rife for a long time and I'm used to having the bulb right next to me. So, but if you were like this question previously, where this noise is really bothering me, you could use the jackhammer amplifier, put that on, and then put it under the bed, and you'll have plenty of power amplification to go through your bed and go through you, get the same benefit as if the bulb was laid right next to you, and be able to have the bulb farther away, and be able to cover it up. So you kind of muffle the sound and muffle the negative effects of what you're hearing and things like that. Some people are bothered by the light. That's why we're excited about the jackhammer, and we currently include it with new Rifes. But most people on this call don't have a jackhammer, and because I don't think you really need one. But if that is an issue, then using the jackhammer can be beneficial. You requested an update on my rash and my hives. This person asked about this about 6 weeks ago. I still have it now, approaching 7 weeks. The right, left, shoulders, and front, upper, chest, mid to lower back. Other areas diminished or stopped. In general, not as bad as it was in the past. Extremely itchy at night. I experimented a little with stopping various protocols for a while. Didn't seem to make a difference. Please note that I have had breakouts in the past over the last few years. Never this extreme though. In the past, I thought it was a skin fungus related to nail fungus I have. Also usually appears as weather warms up too, which is true as this time as well. Thinking to try the Rife Clark mold foot bath or Clark Candida foot bath. I mentioned the rash to my oncologist, wondering if related to the colon tumor. He never answered, but suggested that they restage. He is now retired, and I am getting a new oncologist with restage next Tuesday, arranged with my sister chiropractor, full blood panel. So I'd like to see those results on the full blood panel. If you look at the CBC and you see an elevated eosinophil, that's a segmentation of your white blood cells. So if you have an imbalance in your white blood cells, you might have normal white blood cell count, but you have elevated eosinophils. That's a sign of an allergic reaction. So you're having some sort of allergic reaction Because you can have hives and a rash and it not be an allergic reaction. So some sort of allergic reaction, and typically you're thinking with elevated eosinophils, you're thinking of some sort of environmental allergy, like sensitivity to something that you're wearing, some chemical in the air, so even pollen can give you that, things like that. Those are possibilities. It is possible that you have rash or hives related to cancer. Typically, it's lymphoma that causes rash and hives and things. And it's more so on the lower extremities, maybe on the upper extremities a little bit. Most of the time with lymphoma, you'll get really, really itchy. And I've had people that say they found out they had lymphoma because they had such bad rash that they were scratching and they even caused bleeding. Finally went in and then had some blood tests and found that it was lymphoma. But it has been noted that other cancers can cause this as well. It's not completely certain why that can happen, what the issue is, but it's causing some imbalance in histamine levels in the skin. Other things that you could try are, if you haven't tried like Clear Histamine, Scavenger, or ABP1 Assist, those products might be helpful to calm things down. And over-the-counter antihistamine medication could help. And I actually have that information in my book. I think it's on clomidomide. I don't remember the name, the brand name. It's actually an old antihistamine, over-the-counter antihistamine. I don't even know if you can find it anymore, but it's the same metabolic pathway that that can be an off-label use of a drug. So remember last week we talked about off-label use of medication. Well, off-label use of over-the-counter antihistamines can actually calm down a tumor, calm down a cancer. So I don't know, maybe this is the way God's kind of pushing you to try something like that. Maybe that's going to be a help with your colon cancer. There really isn't a whole lot of negative side effects of over-the-counter antihistamines. Gosh, I don't know. I think I would maybe give it a try. Maybe it's not even going to be for your rash. It's going to be for your colon cancer. Something to think about that. But do send me the results of the CBC when you get that. I'm scheduled to receive a port tomorrow. Are there precautionary things that I should know or do? No, it's fairly safe procedure. I personally have not had experienced any one of our patients over the 30 years plus that I've been doing this that have had issues with their port, except if they've left a port in after they discontinued chemotherapy with the understanding that let's leave it in because we might have to do it again. Then you could end up with an infection and you have to treat the infection. But that's something that they will go over with you, and we're long before that kind of situation. Are there things that I could do to help recover with healing and recovering? Everything that you are doing is stimulating an immune response to help your body kill cancer. You're going to help your body kill any infection. Being in a hospital, I'm especially concerned about infection. I will be put out and receive an antibiotic. How do I combat the effects of the antibiotic? Using probiotics, using gut healing things like butyric acid, and butyric acid stimulating products like an indigestible fiber like Sun Fiber or Sun Spectrum, curcumin to help decrease inflammation of the gut. And so the prebiotics and probiotics are what you want to go to that can help with anybody that has to use an antibiotic. May I use the Rife while I'm using the BEMER, or we'll say any PEMF device? And the answer is yes. So you could use those at the same time. So you could use them while you're doing it or right after. There's no negative effects. I've been using the Rife more during the day as well as overnight. I usually have it near or touching the tumors on my neck. Yes, I think it's best that you have the bulb as close to the lesion as possible. I've had increased discomfort and sometimes sharp pains in the tumor during use. Is this a good or a bad sign? I would say that is a good sign. And I do have a video on this on the blog. It's I think it's called Good Pain, Bad Pain. So you can look for that. I have some writing on that, but I say that's a good sign. I've been putting hydrogen peroxide on the open tumor on my throat, 1 drop or full 7 several times a day. You said hydrogen peroxide can be toxic, taken internally. Yes, it can. Is this okay to do, and how much is too much? Well, it depends on what type of hydrogen peroxide you're using. You should, if you're taking something internally like that, you better only be using the 3% hydrogen peroxide, not the 35% hydrogen peroxide. Even at that, I would attempt to not swallow so much of it. That can be strong taken internally. So if you're doing a dropper full several times a day, though, you're probably just fine. I wouldn't be concerned about it. Just make sure it's just the 3% hydrogen peroxide, not the 35%. Even the 3% hydrogen peroxide, I don't think it's made for internal use. I would be careful. I would maybe substitute hydrogen peroxide. Think about substituting colloidal silver instead of the hydrogen peroxide. So colloidal silver has other benefits that you could just swallow that, and it could be even better for you, have other benefits for you. Is there a brand and form of white willow bark for pain in my throat and neck that you'd recommend? Well, we use the Clear Inflam that I think has white willow bark in it. There is a Cytoquel from Research Nutritionals that I think has other, it's named Cytoquel to quench cytokines, inflammatory cytokines. They're making inference to, so decreasing inflammatory cytokines or inflammatory markers. That I think has white willow bark and other things that we talk about, the flavonoids that we talk about. But Clear Inflam has that in there. And even it doesn't have white willow bark, but our product called BAM, which is which I made for originally created for our brain cancer patients and our Lyme patients. And I call it BAM because it's called Brain Anti-Inflammatory Mix. Not very clever of a name, but that's what it is. And we call it BAM. That comes in a plastic bag, and you can mix it in your smoothie. The benefit of that is that you don't have the capsules. And taking too many capsules, even in natural capsule form, can not be great for a lot of people. How long and at what temperature does a sauna provide detoxing, but not weight loss? Well, a sauna is not in itself, attempting to help with weight loss. A person is using a sauna to sweat. So you're using a sauna to sweat. Now, cancer patients will say, I'm using a sauna also to try to increase my internal body temperature, because if I do increase my internal body temperature even a few degrees, that can make an environment that's less stable for cancer cells, and they might die. So yes, so saunas are great. Saunas are one of my favorite therapies. So now what temperature do you do it? You do it at 140 degrees. Some people do higher degrees. And your goal is that you work towards staying in there 20 to 30 minutes. Now, some people can start with a sauna and you can only be in there for 3 minutes and you can't do it anymore and you have to get out. Personally, with me, I have a difficult time going in a full body sauna. I feel with my nasal polyp issue that I feel like I have a hard time breathing. That's why I like the saunas where your head is out. Those are the ones that we sell and other people sell. Where your head is out, I don't feel claustrophobic. I don't feel like I have breathing issues. It increases the body temperature and helps me sweat just as much. But I still, even at that, when I first started using a sauna, I could only do it for about maybe 10 minutes and I started sweating right away. But I'm just done. Pig, so I guess that's easy for me. Some people, it takes them multiple times doing a sauna before they even start sweating. The idea of a sauna is that you're detoxing through your skin and you're taking pressure off of your liver. And the other idea is to increase your body temperature. If you're finding you're losing weight in a sauna, excuse me, is you got to be rehydrating. Make sure you're rehydrating. You know what? You will, when you're sweating, you're losing electrolytes too, and you don't want to cause dehydration. I lost 20 pounds this winter from going vegan, but can't put weight back on. I feel like my metabolism is on hyperdrive and that I have cachexia. Is there a way to reverse this and gain weight and muscle? I'm sticking to the diet you gave me and eating as much and as often as possible. Well, the definition of cachexia is that you're losing 3 to 4 pounds a week, or 2 to 4 pounds a week, no matter what you're doing. You're not trying to lose weight and you just can't stop losing weight. So if you're like, well, I'm not losing any more weight, but I can't gain it back. The question is, are you underweight? If yes, I'm underweight, I really need to gain 20 pounds back. Well, we do, if you go to this right here and you type in cachexia, I have information on cachexia and some different hints that you could do. And you can do that even if you don't do I have cachexia? Well, who cares about the definition? If you need to gain weight, go back and look at that video on cachexia and some of the hints that I give on that will help. Okay. Can using silver, colloidal silver, as a mouthwash kill the good bacteria in the mouth and gut? That's a good question because you do have good microbiota in your mouth. Every orifice of your body, even on the outer side surface of your body, you have microbiota. That's the negative of using these hand cleaners that came out during COVID. They're just not good for you. They just disrupt your normal flora. They disrupt your microbiota even internally. You absorb them. They're chemicals. Now you're dealing with oxidative stress from that. It's just poison. So I'm not in favor of doing that. Can using colloidal silver or using even oregano oil in your mouth, like our tooth and gum oil with black seed oil. Can using the different mouthwashes that we sell in the store disrupt the flora, the microbiota in your mouth. It can. You will never kill all of it. But what you're trying to do is you're trying to knock down the overgrowth of pathogenic microbiota. So like the one that we have from the company Biocidin. Biocidin is a great company. They formulated their mouthwash. That's the one I use. I think that one's the best for dental issues. Now they just came out with that last year, and they have a whole dental protocol. You do it for 2 months and stuff. But using colloidal silver, I don't think you're gonna throw off your microbiota of the mouth. I don't think so. My vitamin D level is at 45. I'm trying to be in the sun as much as possible, but is there a way through supplements to help raise my level quickly? I'll be starting chemo soon. Yeah, well, taking D3 is your number, just taking it orally and getting, doing, between 5 and 15,000 IUs a day is the fastest way to raise vitamin D levels. Now, understand there's some people that they can take 20,000 IUs of vitamin D a day and they just can't absorb it and utilize it well because they have what are called VDR, vitamin D receptor defects on their genetic pathways, and that can interrupt their ability to maintain healthy levels of vitamin D. It's probably not your case. I don't remember your genetics. I don't think that's, I have had anybody with, double allele defects on all their VDR and VDRQA X genes. I don't remember anybody recently that has had anything like that. So just taking vitamin D levels. Now, vitamin D is made in the skin through 7-hydroxycholesterol, but that's the danger of taking statin drugs, because it lowers that level. You will decrease your vitamin D levels in your blood by taking statin drugs, because you need that form of cholesterol in your skin in order to make vitamin D from sunlight. So taking vitamin D and D3 is the one you want to take, is the thing to do. I started taking 5 Defender mushroom supplements. Can I have side effects from this? After starting it, I felt depressed instantly and felt nauseous after eating. That's the only thing I did different. Yeah, I'm not familiar with that brand. So understand the mushrooms that you want to take, you want them to be hot water processed mushrooms. So if they're not hot water processed mushrooms, you could be getting allergic reaction from a mushroom product. That's why we sell our private label mushrooms and Host Defense mushrooms. Those are the only 2 mushroom products that I really recommend, is the ones that we've created or private labeled, or the Host Defense brand mushrooms. So I'd look into that. A lot of other mushroom products, a lot of other supplements out there that can just not be good quality supplements. And I've shared with you multiple times an interesting study that was done a number of years ago now, that they took GNC, Target, Walmart, Walgreens, and some other store supplements. They took ashwagandha and a bunch of different supplements, and they tested them, and some had like 0 of the product in it. So second thing that can be possible is the capsule. Some people have reactions. Some people have antibodies to glycerin. Some people have antibodies to what the capsules are made of, and that could be an issue too. So those are the things that I would investigate, because typically you won't get those effects from a good quality mushroom. So I think something else. When I begin chemo, will my RIFE programs need to be revised? No, we won't need to change your RIFE programs. Are there things to do to prevent hair loss during chemo? The only thing that has been shown to prevent hair loss during chemo is using cold packs on your head. There's actually a company that makes a fitted, like a helmet that is made out of that cold pack gel stuff that you put in the freezer, and then you put that on your head. By chilling your scalp, you can decrease the blood flow to the scalp, and the chemo, as it's flowing through your blood, won't damage the hair follicles, because that's what happens. The chemo damages the hair follicles and your hair falls out. Now, after chemo's done, usually your hair grows back in. But if you could chill the hair follicles, then you'll have less chance of your hair falling out. But of course, you don't want your hair to fall out only in certain spots. So getting like those helmets, and you'd have to Google the company that makes those. We've had a couple people that have used those and said that they really help. And I've seen testimonials of people that have used it and it really helped. So that is one option. I would say when you're going to do chemo, you do need to go back to the blog and look up the chemo protocol, because you do not want to be doing, strong antioxidants during the 48 hours after your chemo IV. So let's say if your chemo IV is at 9 o'clock on Monday morning, you'd go off of your antioxidants for 48 hours and then you'd go back on, at least 48 hours after that time, after let's say you finished the chemo IV at noon on Monday, you wouldn't go back on any antioxidants until noon on Wednesday at least. And on that chemo protocol, doing a 24-hour fast prior to the chemo is highly advised. The reason is, if you think of it like a cartoon, cancer cells are hungry, right? So they're gobbling stuff up. Well, if you do a 24-hour fast, they get super hungry. And then you give chemo into the bloodstream, they're going to eat anything. And the idea is, if you can think of it that way, they'll gobble up the chemo. Well, there has been just time and time again of people that have done that. And the testimonials are they have just 50% less side effects from the chemo. The chemo tends to work better. They just have better results. So doing at least a 24-hour fast prior to the chemo. So if you have chemo at 9 o'clock Monday morning, you stop eating at least at 9 o'clock Sunday morning. So your cancer is super hungry and it'll gobble up the chemo. And then you also go off all your antioxidants until at least 48 hours after the chemo is done. Do you recommend Clear Multi-Min for most people? Well, not everybody needs it. So certainly in the summertime, if you're out sweating a lot, or if you're doing saunas on a regular basis, taking a mineral supplement is good. If you're taking the greens supplement and you're eating real well and you're eating, where do you get your minerals from in your diet? You get your minerals from your vegetables. So for people who, in general, for people who are like not big vegetable eaters, they don't eat a lot of salads, they don't like a lot of vegetables, or their idea of vegetables is corn. Corn is a grain, not a vegetable. So if that's their idea of vegetables, they're probably deficient in minerals. And yes, they should be taking a product like Clear Multi-Min. But even for our patients, most of our patients are eating really well, eating better than they have in their life. Some of them taking the green supplement. Well, Clear Multi-Min isn't necessarily necessary for everybody. So the reason why we use the Clear Multi-Min is it's iron-free, because why would you want to not be on iron? Well, iron is highly inflammatory. If you're deficient and you have anemia, then you may need to be on an iron. But if you're not anemic, then you shouldn't be taking iron, and you shouldn't be taking iodine. If you have any hint of any possible Hashimoto's, thyroid issues, or other autoimmune issues, you want to limit your iodine levels. So that's why we picked that product. My pancreatic cyst started at 3.5, and the second test, it was 4.2. Just did another ultrasound, it was 3.2. I'm waiting on my RGCC to come back. Any chance my cancer markers could be increasing while the cyst is decreasing? Or is that not enough of a decrease to make a big deal of? Well, I'd say, I mean that's 25% decrease, 4.2 to 3.2. That's a big decrease. So I think that's great. Will you have a change in your tumor markers? You may. Again, you've seen and you've heard from other people that tumor markers can be fickle. So a person can go on chemo that's actually shrinking the tumor, and the tumor markers actually go up because the cancer cells can spill more of that protein. So you have to look at multiple markers when you look at whether success or failure. So look at your symptoms, look at how everything else is going, look at tumor markers. I think it's a good thing to measure on a regular basis so you could get, graph that out and see the trend. So that's what you want to look for. Doctor wants me to stay on a chemo plan for 6 more weeks. Then switch to another family of chemo pills. I think that one raises your insulin. Maybe a phone call would be easier to talk about this. Checking into Humanizing Medicine in Atlanta. They would do mistletoe but they are wondering if chemo may be the next step to get the tumor burden out of the body. What do you think about this? I don't think you can, in your state, and we maybe should do a call, but I do think that I do agree with your oncologist that your body can become kind of immune to a chemo after a period of time, and changing up a family of drugs can be good. If you have one that raises your insulin, you can conquer that with other things like berberine. So berberine can lower your insulin, can lower your blood glucose level. And that's how you could work through it with other, deal with it with natural methods to deal with the side effects of a medication. I thought berries are good to eat when you have cancer, but Gerson says no to berries. What are your thoughts? Because I have been on a lot of berries. I was not listed on my list of not to eat from you or my RGCC doctor. Well, a lot of berries can be very high in antioxidants again. So berries have a lot of good benefits to them. Now, berries also have sugar, can raise your glucose levels. That's why getting a glucometer and just checking your glucose levels can be a good thing to do. You could go to Target or Walgreens or something like that and buy a glucometer for really cheap. You always want to check that in a fasting state. Now on the member site, I actually have a form you can download to measure your glucose on a regular basis. You always want to do that in a fasting state. So typically you do that when you wake up in the morning. You measure your glucose. The goal is really to get your glucose around 75, 80. That's really what you want to do. And if berries are spiking it. So again, we could talk an hour about this because some people can eat some carbohydrates and it really does very little to their blood glucose. Some people can eat just a little bit of carbohydrates and their blood glucose just spikes through the roof. Why is that? Because it's has to do with how damaged your cells are, the insulin receptors on your cells. So your glucose level has a lot to do with your diet, but it has even more to do with the health of your cells, your cell membranes in particular. Also the health of your pancreas itself, because your pancreas, part of your pancreas makes insulin. But if a person, let's say, doesn't have an issue with that part of the pancreas, they do not have type 1 diabetes, which is an autoimmune disease on the islet cells of the pancreas that make insulin. To say they do not have that, and they have issues of getting their glucose levels down, then it's really a cell membrane issue. I just talked to somebody the other day that said that they were eating really super healthy and they actually went on a keto diet and they were doing really good on their keto diet. They did it for 3 months. They did really well. They went off their keto diet and they're still eating super, super clean. This is actually a fairly young person, but they noticed that their glucose levels spiked. And I said, well, what are they at? She said, I can't really get them down now. It's been months. What are they at? They're in the 200s range. Holy cow, that's not good. So I said, you immediately have to get in and get checked. My suspect is that a ketogenic diet actually sparked an autoimmune attack on the pancreas. This person has type 1 diabetes now. I don't think it's type 2 diabetes. I think it's type 1. So the difference between type 1 diabetes and type 2 is type 1 is an autoimmune disease on the pancreas. Type 2 is just damaged cell receptor sites. And so totally different. It should be called something different, but both result in elevated glucose levels. So maybe too much information, but it really depends on your glucose levels ultimately. But in general, I disagree with Max Gerson. I think that berries have much benefit. Now, if you're drinking juice, like grape juice or raspberry juice, I don't know if there is raspberry juice, but that is you're just getting the sugar. You're not really getting the benefit. If you eat the whole food, there's huge benefits of the whole food and the synergistic nutrients that are in that food that we haven't even discovered yet. So eating the whole berries is has lots of benefits. But to really make sure, getting a glucometer and checking your glucose would be the way to go. Should all Rife programs have a loud noise? As I don't hear anything except a very low pitch sometimes. Correct. A lot of, right, it depends on the frequency that you're running. A lot of the lower frequencies for different types of cancer can have a louder noise. Some don't have anything. I don't ever hear anything with my Rife. But I guess I take that back. At different times, I wake up at different times to go to the bathroom or something. It's like, boy, my Rife is noisy. Well, it's because I never heard it before because I was sleeping. But I just happened to wake up at this time. And that's probably one of the number one questions that we get. Oh my gosh, I woke up to go to the bathroom and my Rife was just like making this really loud noise. Is there something wrong with that? It's never happened like this before. Well, you probably never woke up on that particular night. Remember, every one of your nights are different. And so they're running different frequencies at different times. You never woke up at Monday night at 2 o'clock to go to the bathroom to hear that. And you actually went to bed at the exact same time. So you're running that exact frequency at that time. So different frequencies will cause more noise. I plan on using the CurcuClear soon for curcumin. Before joining the clinic, I had a large supply of Terry Naturals, Curcumin 750 milligrams. Is this brand good to use up for now as I still have 2 months left? I would say, yeah. I mean, I can waste supplements. Most of the curcumin supplements out there are fine. Most of it's the minerals that a lot of the mineral supplements are garbage. A lot of the mushroom supplements are garbage. A lot of the herbal supplements are garbage. You're fine with curcumin though. What is your thoughts on medium roast coffee versus golden color light roast coffee? So the light roast coffee that we use is specifically for coffee enema. So if you bought it from us, it's coffee enema coffee. If you try to drink it, you wouldn't be able to drink it. It's just you get sick. So it has got much higher caffeine to stimulate your parasympathetics. And that's what you're trying to do, is stimulate your vagal nerve with the coffee enemas. Now, again, using any coffee, let's say I don't have that. Can I just use any coffee? Yeah, you can. But the light roast coffee is just better. Is gluten a good supplement to reduce gluten? So these, I'm not familiar with Gluten Away, but these products like that, these gluten and dairy reducing supplements, they're not to reduce gluten. They're if you're on a gluten-free diet or a dairy-free diet and you're eating out and they tell you it's gluten-free, but you're afraid that you could get cross-contamination and you're trying to reduce it. These are enzymes. So these products like Gluten Away or Glutenzyme or Glutazyme is the US enzyme one. We have 3 or 4 different brands that have it. All they are is gluten enzymes. They're enzymes that will help break down gluten. It doesn't give you a carte blanche to eat gluten and then you take one of these and it's going to be okay. No, it doesn't work that way. Do any of these type of supplements rid your body of excess gluten? No, none of them do. So it's just going to help break down any hidden gluten that you might have got from eating that meal. So we have multiple of these orthomolecular. Again, we can't have orthomolecular on our site anymore. They have a DG Zyme or something like that for dairy and gluten. It's enzymes for dairy and gluten. US Enzymes has a Glutazyme. That's a real good one. Apex has one. There's multiple. Science for Health has an Allerzyme that's got dairy. It's enzymes for dairy and gluten. Also, is lactoferrin good for anemia in lymphoma with low blood counts? I don't know. I'd have to research that. I'm sorry, I don't know the answer to that one. So, can I try 2 different programs on my Rife on the same day? You can run a different program every hour on your Rife. on the same day. You can use it. You can use it all day long, and yes, you can do whatever you want. So you can't overdo that unless you're doing kill programs like Lyme disease kill programs. You can overdo that because of the lipopolysaccharides in a gram-negative bacteria. Now that my tumors have been removed, is the armpit the best place to place the Rife bulb at night, or the liver? It's still going to go through you either way. You can lay by your side. Either way, it's going to be penetrating you, so it's not really that important if it's near you. Only food grade hydroperoxide is for internal use, 1 drop times 3 a day. Still, it's 35%, so I would be careful of that. I would agree with this. The 3% over the counter is not for internal use. So I would not be using that. I mean, it probably won't hurt you, but I still wouldn't use it. I've been alternating hydroperoxide and colloidal silver and turmeric tincture each hour on the open tumor in my throat. But if it's internal in your throat, thereby you're swallowing it, I would not use the hydroperoxide. Following up on the itching rash, I caught a cold a few days ago and I had 100-degree fever on Monday. What was surprising is that my fever, all itching, went away completely, at least for a day. Any ideas? Oh, wow. I got to think about that a little bit. So having a fever decreased. I have to think about that a little bit. Why would a fever have decreased? Unless a fever increases your DAO enzyme. That's it would be my thought. Fever may decrease or may increase the production of the DAO enzyme, which is made through a genetic pathway or HTNM pathway. How you get rid of inflammation, histamines, and histamine-like cytokines in the tissues and in the skin. So I bet you a fever increases the production of DAO enzyme. I'll have to research that. Thank you for that observation. I heard that a sauna, what temperature? 104, 140 degrees. Do you have a D3 you recommend? Yes, the ADK Avail, ADK Complete. So that's what we would recommend. Look and see if I have you on that. Will the Rife program for Candida be enough to get rid of overgrowth? We've had people get really good results with the Rife and using it for Candida and other fungi and molds and infections and biotoxins. Will that be enough? I don't know. The benefit of using it first is that you're not going to you're not adding chemistry to the body. So when you're using like uva herb and you're using berberine and you're using different herbals to kill a pathogen like that, you're changing body chemistry, which is fine, but a lot of people are on a lot of things already and you don't want to be on any more stuff. That's why I always say use the Rife as your first go-to to try to kill it. You can't do wrong with it. I would definitely give it a good go. And then if you have to add black cumin seed oil or something like that to it, maybe you could do one at a time to see how you can do that. Nina, you asked about the D3 supplement. I looked and you said you had Metagenics D3 10,000 plus K. If you still have that, take that. So that's a good supplement. Take that one. If you don't have any of that anymore, then I didn't. So I didn't say stop on that one. So I assume that you were still taking that one. So if you're not, then let us know. I'll get you know what to take. I ate the Gerson muesli for several months every day. It was not curative as the tumors continued to grow. However, would it still be good to continue? I don't remember what that is. I haven't looked at that for years. I'm sure it's fine. It is carbohydrates, but I'm sure it's fine as long as the ingredients don't go against what we told you to do. Can tumor markers increase because of pathogens? Oh, I don't know. I've never heard that to be the case. I wouldn't think so. So I wouldn't think so. My glucose was 87, but my A1C was 5.4, which is not elevated, but it's getting up there. Should my A1C be lower? Not, this is where, dealing with blood glucose isn't as simple as I'm going to go on a diet, not eat sugar, and my blood glucose is going to go down. My hemoglobin A1C might be elevated. That's a better indication of how you're processing glutathione. Oh, the muesli is cottage cheese blend, so it's the Budwig protocol. I don't know if dairy was a driver. I think dairy was a driver, so I said no to it. So I would say no to that. Glucose at 87 is not too high, but when you're dealing with cancer, and if you had, which you don't, if you had a really active cancer that you're trying to deal with, you really want your glucose to be lower than that. But in your case, your cancer is in pretty much a state of remission. So do you need to work actively to lower it? Not necessarily. Are there other things that you can do to help decrease your hemoglobin A1C? Yes, from a nutritional standpoint, my first thought is berberine. Chromium can help with that too. And then look at your diet. If you're boy, I'm eating really clean. I don't eat a lot of sugar. I don't eat any of that stuff. And I wouldn't worry about it too much. If you have berberine, if you have picolinate, chromium picolinate at home, you can start taking some of that and see how that could help with your cell membranes. Okay, we've got a long time. I think we will call it for the day. Thanks for getting your questions in. Try to make every effort to get them in as soon as you can. Otherwise, I may not get them on the call. Know that I'm praying for all of you, and I will see you next week. And call me if you need to chat with me. Bye-bye.